This is the last video in the series of educational videos for the open preperitoneal inguinal hernia repair at Boston Hernia. This video is intended to talk about the months and years after an open preperitoneal repair. Typically, you've had one post-operative visit to ensure that the hernia repair has gone well. We typically advise you that the swelling after surgery or the firmness along the skin and the area of the hernia will go away in that first 6 months after surgery. Along with that, any tugging, pulling, twinges of pain should typically go away. Typically at the 6-month period, you'll get an assessment from us or the Abdominal Core Health Quality Collaborative, and then once a year after surgery. If you still have a bulge at 6 months, that's not unusual, but at a year, any bulging should be gone. If it's not, when you check it off in the ACHQC assessment, that should be a reason to call us because we want to see you and make sure that it is not a recurrent hernia. Typically, most people have forgotten about the surgical experience, have their quality of life back, have returned to all normal activities a month after surgery and certainly ramped themselves up. But as you become more vigorous, some of the complaints that we see after surgery is pain either on the side of surgery or the other side with activity, rolling over in bed, getting out of the car. Typically, we see these in people who don't have a routine strength training program or have started a strength training program that's a little bit different or have recently done some moving or lifting. And that's typically what's called a core muscle injury. It's an imbalance in the core. Oftentimes occurs near the rectus abdominis muscle or the adductor muscles. And we see this either before or after hernia surgery. Sometimes we see it people who've never had hernias or hernia surgery, but it's a result of an imbalance in your core. That is the #1 reason people come and see us after hernia surgery. It's not recurrent hernia, though we do see recurrences in approximately 0.5 to 1% of our patients, at least through my 24 years of experience doing this. If you do have a core muscle injury, we can diagnose it by physical exam alone. There's no need for testing, and typically we have a list of physical therapists that can help work with you, but we do recommend a strength training, whether it's body weights or heavy weights, to maintain core strength and integrity of your abdominal wall. Hope this was helpful. If you have questions, if you're doing research about hernia surgery, open preperitoneal, I think, is the best way to fix a hernia if your BMI is below 33. And we look forward to meeting you. If you've had surgery in our practice already and you're using this for education, I hope this was helpful. Feel free to send us an email to give us some feedback about what was helpful or what else you'd like to learn about.